to your hour. Joining me now is Jamie Whitfield, who is my assistant, and among other things, Jamie is a recovering addict, and she has been working really hard at her. She takes her recovery extremely seriously, and not only does she take her own recovery seriously, she also wants to be of assistance to others who would like to recover. Um, One of the terms that you use quite often is self care.
Yes.
Now, I think a lot of us think we know what self care means, but when you have been an addict, you have really abused your body
Yes, you have.
quite a bit, and
Yes.
self care might mean a few other things than what
Yes.
we might obviously think.
Yes, so self care, the actual definition is the practice of taking action to preserve or improve one's own health.
Hmm.
And so for, like you said, for, so many years, we've neglected our mind, body, and spirit, and
Hmm.
that's part of self-care. And we've also just, we don't even know what that means because our self-care in our active addiction was running to that instant feel good, and that was the drugs.
And staying away from the police.
Yes. And so, basically, we abandoned, our spiritual well-being, our
Hmm.
physical, our emotional, and our mental. And so, self-care in recovery, though, is something that basically it's like your body just needs a tune-up,
Hmm.
And so, I have a couple points that the to self-care on the physical aspect is like getting good, exercise, getting
Hmm.
good rest, just taking care of yourself physically, proper diet is
Hmm.
important. And then personal hygiene is a major one, for self care and recovery as well. And then when you go to the mental health aspect, you just want to be mindful,
Hmm.
a lot of addicts suffer, not everyone, with dual diagnosis, being that they have the addiction side and then they have the mental health side.
Mm.
And so, sometimes people want to not take care of that mental health part aspect of it. And it is okay to take medication when needed,
Yeah.
for your mental health. It will give you that balance.
Hmm.
Sometimes people don't need it and they can balance things out, the further along they get. But some people need the medication,
Yeah.
the psychological and the psychiatric part of mental health. And so I think that's really important as well.
Yeah.
And then your emotional needs, confronting and coping with your feelings. We, in our active addiction, we run from our problems and our
Hmm.
feelings, and now is a time with that self-care in mind and recovery is to no longer run and cope with the feelings that you're having.
Yeah.
Don't stuff them. Just don't run from them, because that will keep you sick and that's not healthy.
Well, right, because if you address the problems that you have, um, emotional or physical or mental, any of
Hmm.
those, if you address them, then chances are your recovery is going to be more permanent than
Yes.
if you don't. Because if you
Yes.
don't address those things, they're going to come back and haunt you.
Yes, and basically, self-care, what you're doing is you're maximizing your recovery by
Hmm.
taking care of yourself.
Yeah.
And why not enjoy life to the fullest in recovery,
Hmm.
and self-care is very, very important. And I'm actually still practicing self-care because sometimes I run myself ragged, or I don't set healthy boundaries, as far
Hmm.
as being able to say no to certain things that
Yeah.
are just exhausting or to my children,
Yeah.
just different things. And then another I feel like this is like one of the most important part of self-care is the spiritual self-care, the spiritual aspect,
Hmm.
because our program is basically a spiritual, not religious program.
Right.
And I think this is a very important and to be part of that self-care is that spiritual aspect as well.
Mm-hmm.
And there's different, you don't have to be religious to be spiritual.
That's right.
You can, there's like different practices like praying, meditation, yoga. You can even find a connection with nature and find that spiritual,
Mm-hmm.
practice of just being, find that calmness,
Yeah.
and so, there's just little different areas in the self-care that are very important. And these are like the five major ones.
Yeah. Well, I know you kind of struggled with some of those
Yes.
initially,
Yes.
um, but I can tell that you're really getting a handle on it.
I'm trying. For so long we have just been so used to uh, self-medicating as far
Right.
as our self-care, and so now we have to relearn how to take care of ourselves,
Uh-huh.
and so it is a process, and the more you do it, the better you'll get at it.
Well, and you mentioned before, you know, for those who need medication, they should take that
Yes.
medication. Um, I think sometimes an addict has a little bit of trepidation, maybe,
Yes.
about taking medication because of their addiction,
Yes.
because of their uh, propensity towards
Yes.
becoming hooked on something.
Well,
So,
and I think that, um, for somebody that's sick, you go see a doctor, and so I think it's just appropriate that if you are suffering that dual diagnosis, with addiction and a mental health issue, that you seek help,
hmm,
and it don't even have to necessarily be medication. It could
right.
just be therapy,
Hmm.
so I think that's important as well to keep in mind. And just self-care promotes just health and wellness, period,
Hmm.
all the way around, mind, body, and soul, so.
And actually, self care is something that everyone should practice.
Yes.
But I think it becomes, for someone who's recovering, it becomes probably a little more, I don't know, I want to say a little more important, um, a little more urgent, maybe,
Yes, yes,
for
because
someone who's
the self
recovering.
care has been neglected, for so long. So
Hmm.
and it makes your recovery even more rewarding and
Hmm.
just able to maintain it.
Yeah. So, um, next week, we are going, when we have you, oh,
Monday.
Monday night.
Yes.
Talk about your meeting.
Okay, so Monday night, I would just like to invite women out to come join us here at 934 North Water from 7 p.m. to 8 p.m. It is a NA meeting, but anyone is welcome to come. Just join the fellowship, the sisterhood that we have to offer. And that's Monday from 7 to 8, 934 North Water here at the station.
And if you have questions about that, you can give us a call at 337 5501. I don't even know my own phone.